Now, elsewhere this morning, NHS leaders are asking the Prime Minister to extend the Brexit transition period, warning that a no-deal outcome could risk the health of patients during the coronavirus crisis. Joining me live here on LBC News is Danny Mortimer, the Chief Executive of the NHS Confederation. Thank you very much for your time this morning. It sounds like you're pretty concerned.
Yes, we are. I think what we're seeing now is the desperately unhappy collision between the deteriorating situation regarding the virus, particularly in London and the South East, and also the cliff edge now of a no-deal scenario at the end of this month. And our call to the Prime Minister, I think in common with lots of other sectors of the economy, is to seek an extension for a month to get the Brexit deal done, to get Brexit done indeed, but to make sure that we avoid the disruption and impact on our services and our patients.
What kind of impact do you think a no-deal outcome would actually have on health?
I think there's a few things to say. I mean, health is a small but important part of the negotiations that have taken place over the last 4 years. We have a set of arrangements in place for patients, for all of us, as we travel around the European Union to access healthcare, for example. A no deal would mean those weren't in place for us when we can visit countries in the EU again, but also for EU citizens visiting us. And what we need to have is 27 separate arrangements in place with those countries. That clearly just is, creates all sorts of problems, not least for our patients. We lose access to the data sharing that we have between health bodies and our counterparts in continental Europe. We lose access to research participation, which has been really important, that the NHS has been central to for so many years, and we face disruption to our supply chains in particular. And whilst the NHS has done everything that has been asked of it in terms of trying to stockpile vital supplies for the event of a no-deal scenario, again, the fact that we're trying to do this, we may have to do this whilst we're dealing with this new outbreak, this new really serious surge in coronavirus, just really worries us, really worries our members.
What kind of state is the health service in at the moment? Obviously, COVID-19 is putting pressure on the system, but how severe is that pressure compared to what would normally be seen in a normal winter? It is much worse than a normal winter, and we worry, particularly in London and the South East. What we're seeing now in Kent and Essex, and also in some parts of London, is real disruption to non-COVID services. But we also have real worry about that across the rest of the country as well. We're seeing that disruption already in some parts of Wales, and we're worried about it playing out. What NHS organisations are having to do, John, is both manage COVID, which is a new pressure much bigger than anything we would normally see, and deal with the winter pressures that we would encounter in terms of respiratory disease and our elders becoming iller, and maintain non-COVID services, and of course support the rollout of the vaccination programme as well. And trying to do all those four things is just really, really difficult. And the more we see rates of infection, we know that means admissions will increase to our hospitals, and unfortunately harm will also be done to the population, and there'll be disruption to our services as well. We are hearing suggestions that more areas of England are going to be put under Tier 4 rules. Is that something that you would support?
I think we obviously in the NHS don't have access to all the data and advice that the Prime Minister and the various leaders have across the four nations. What we would say is that, again, experience this year tells us is that our patients and our communities, our staff, want clarity and certainty. And what they also know, of course, is that in the absence of a truly effective test and trace system, lockdowns, Tier 4 restrictions, other types of restrictions in various parts of the UK do slow the spread of the virus. They do give us a chance to manage those various impacts or better manage those various impacts and demands that I described in terms of our services.
Okay, Danny Mortimer, Chief Executive of the NHS Confederation. Thanks for joining us here on LBC News.